So we find periodically having family meetings are really advance and move forward the recovery quite a bit. It's an important part.
And finally, the group therapy and the therapeutic value of group therapy.
Right.
Tell us a little bit about that and the experience that you've had at your
Right.
practice.
Actually, I would say the group therapy is maybe one of the pieces that surprised me as really kind of cracking open a person in isolation. Addiction is a disease of isolation, and people, I've had people tremendously resistant in my practice to agreeing to join a group that we're running at the practice, no matter how small it is. And my groups are often 4 or 5 people and not much more than that. But had people have kind of amazing breakthroughs, realizing that how stigmatized they actually felt in being in a room full of people who are people that they respect and can relate to, seems to cut out that stigma, and which is a huge part of what blocks people from recovery oftentimes. And the isolation. I think being able to feel how good it feels to connect with people and feel that connection is a huge step.
Now, you mentioned yoga,
Mm-hmm.
and what got you interested in implementing yoga into an addiction therapy, and what kind of results have you seen bringing yoga into your practice and working with the addicted population?
Actually, I had an experience in yoga after I had a riding accident and fell off a horse. Had a pretty significant back injury that, after months, really just wasn't healing. And I saw a yoga therapist, a brand of therapy called Swarupa Yoga, which focuses on the spine, the lower back. And if you know anything about yoga or chakra therapy, the lower part of the spine is associated with security, groundedness. It all kind of makes sense in a way. It's called the root chakra area. And after doing work with this particular yoga therapist, Pepper Wolf, who is also a master social worker, the two of us were talking, and as we would have the sessions, talking about how this would apply incredibly to the addicted population. I can't remember, but it's like the two of us just almost simultaneously realized that this was an incredible application. She'd been working on it as a graduate student, thoughts about how appropriate it really was for addicted persons. So it was a personal experience, and then we actually, Pepper started teaching some groups with me in my practice for addicted people, and it surprised me how accepting people were of doing yoga in class. We moved all the furniture out of the room, our small waiting room, and people took to it immediately and found that it was something about just being able to sit back and relax and be encouraged to settle into their own body and to try less hard. I think a lot of times people are saying to addicts, try harder, you've got to try harder. And that's sort of a maxim of our culture. Push harder, try harder, do more, rest less. And something about these stressed out people, when someone actually says, sit back, relax, take a breath, do more by doing less, accomplish more by doing less. You know,
You
it
also
was,
mentioned the benefit that you've seen from kind of like the peer-to-peer recovery coaching. Could you touch briefly on how that's been in your practice and the response you've gotten from people that have participated in meeting with a recovery coach?
I think there's nothing like people who are struggling with a specific problem, talking face to face with someone who has that problem and has mastered it, has made headway. There's just nothing like it. And my dream is actually ultimately that in the end, when people have done well, maybe after a year of sobriety, may become alumni of the program and actually become counselors themselves on this peer coaching basis. We can train them.
Now, your practice also includes a level of medication management for the person entering the recovery process. Can you touch a little bit on the medication management aspect of your practice and how it kind of complements the other services, including like yoga, recovery coaching, the individual and group therapy? How does medication come into play?
Well, as you might think, as a general adult psychiatrist, I am meeting a lot of my clients because they are suffering from depression, bipolar disorder, anxiety, a number of things. And the medications are have to do with a specific diagnosis that that person has. A lot of times an addiction will emerge that I was unaware of, and it's very common for people to try to self-medicate with a psychiatric illness with recreational substances. And we have found that there are medications that are very, very helpful, especially with the opiate addiction. Suboxone or buprenorphine is a partial mu opioid agonist, which is an excellent way to detox people from street opiates and control symptoms. It's not a high for people, however, it does control the cravings and withdrawal symptoms pretty effectively, and give people a margin of time to work on preparing to release opiates as a way of coping in their lives, to create a fuller life and a foundation where they can let go.
Now, tell me a little bit more about Suboxone, and I know some of the stigmas attached to it, like how Suboxone works and why the use of Suboxone in your practice isn't replacing one drug with another, and the immediate benefits of an opiate addict that hasn't been able to stay sober,
Right.
getting on Suboxone.
Well, first of all, your brain Suboxone is a long-acting opioid agonist. And what that means is a partial agonist is that it's stimulating the opiate receptors in the brain instead of like a short, intense burst, like let's say like a love